Hello everyone, and I hope everybody is doing perfectly fine. So today we'll be discussing a very small topic, that is capillary hemangioma. So just to start with, this was a very common case, not so uncommon, but usually we can see it at various other sites. So this case was a case of a 38-year-old male patient who presented with an indurated swelling in the back, and it had a papillomatous projection like growth. Fine. So on gross, what we received was a round to oval skin covered tissue which measured 3 into 2.5 centimeter, and surface of skin it showed a grey white nodular lesion which measured 1.2 centimeter in diameter. And the nodular lesion, it had a bluish black discoloration. This point is important because in hemangioma it is a vascular lesion. So grossly also when you see, it has some bluish tinge or reddish bluish or bluish black tinge, it is there. So you can just make out or keep hemangioma as a differential in that case. So cut section, it showed grey white and focal hemorrhagic areas. So this was the gross picture which we got of the swelling which was present on the back of the patient. So when we made the sections, and after the section was stained with hematoxylin and eosin stain, what we observed was a tissue which was lined by a keratinized stratified squamous epithelium and the subepithelium below the skin. I'll show you the diagram also. It showed numerous variably dilated vascular channels which comprised of small and intermediate size of blood vessels, and few were filled with fibril. And these vessels, it was lined by a single layer of flat endothelial cells which was surrounded by your fibrocollagenous septae. No atypical cells were seen in the section examined. So this I was talking about. So this above is your squamous layer, and it is a keratinized stratified squamous epithelium. So all the layers, this epidermis, you can appreciate it. Now below the epidermis, this is your dermis, the whole thing. So subepithelium. So below the epithelium, this is the epithelium, and below this epithelium, this whole dermis, it what you can see is variably sized dilated blood vessels are seen, and this is the fibrin filled. The RBC, you can see small fibrin pink reddish dots you can see within the lumen, and these all are the these are the vessels, and these are lined by your thin single layer of endothelial cells. That is what the endothelial lining cells we mean by when we say that capillaries are lined by these endothelial cells. So they capillary hemangioma, they are found in the lobules. So one lobule is that these lobules are divided by the fibrocollagenous septae. So what you have to remember, this swelling kahin bhi ho sakti hai, but these are your benign vascular swelling, and these are well circumscribed and they lack endothelial cell. When you saw the single lined, the capillaries were single lined, but it was very bland looking type of cells, correct? So they did not have any kind of atypia in it. So originating from large non-neoplastic feeding vessels, and basically these are of different types. The hemangioma, what we say about, it can be your capillary hemangioma which we saw here. These are composed of your compact lobular collection of small blood vessels. In cavernous, I'll show you next lecture, I'll give you the picture. So these are dilated vessels which are filled with the erythrocyte, large vessels which are dilated. In cavernous you see it, correct? Then in venous, what we see is vascular structure, they contain muscular wall of varying thickness, and perilobular also hemangioma is there. Those are very less than 2 millimeter capillary hemangiomas, intra or interlobular in location. So capillary hemangioma is what we saw on the back of the patient. So differential diagnosis also you need to remember कि जब हम capillary hemangioma करें, we need to rule out. It can be angiolipoma also when the vessels component and the fibroadipose components both are there in it. So it has an intermixed adipose tissue, cluster of capillary sized vessels, some with microthrombi as we saw. Then angiosarcoma. So it is highly malignant. So you will see solid sheets of atypical cells, mitotic activities increase. There are infiltrative pattern of growth patterns, and anastomosing vascular channels are there. So they are like, this is a particular histological findings in angiosarcoma. So there are anastomosing vascular channels which we see. Then coming to atypical vascular lesions. So they have often past history of radiation, or then anastomosing thin walled vessels unlike well formed vessels of the hemangioma. Hemangioma is a very organized vascular architecture which we get to see here. So thank you so much for your patient hearing. Kindly like, subscribe and share my channel Patho with NK. Thank you so much.